Hi, and welcome to this poster session on the Intersections Initiative, Healthcare's Key Role in Partnerships to Advance Health Equity. My name is Katie Miller. I'm a program manager at Prevention Institute, presenting on behalf of our team, which includes the St. Joseph Community Partnership Fund. I will be joined by guest speaker Dan Schurman. The Intersections Initiative brings together coalitions from the 7 California communities served by Providence St. Joseph Health System hospitals, with the goal of advancing health equity by addressing the community conditions that shape health, safety, and well-being. The 7 coalitions are tackling issues as diverse as affordable housing, education, economic and workforce development, community trauma, and civic engagement. You can see the locations of the 7 communities on this map. The initiative is funded by the St. Joseph Community Partnership Fund and co-developed with Prevention Institute. During the planning phase, we engaged hospital representatives in the 7 communities to convene partners and identify issue areas guided by resident leadership and input. Our foundational frameworks are Prevention Institute's Tool for Health and Resilience in Vulnerable Environments, or THRIVE tool, and Adverse Community Experiences and Resiliences framework, also known as ACER. These tools provide guidance for thinking about the social determinants of health in the context of community trauma. We are currently wrapping up our 2nd year of implementation, which was preceded by a 1-year planning phase. We've learned that the flexibility and intentionality of our planning period was essential for grounding participants in what upstream prevention is, cultivating authentic community engagement, and building the capacity of partners. I've included this graphic from Health Affairs that depicts how strategies and tactics can move from downstream and midstream interventions that primarily target individuals to upstream policy and system solutions that impact whole communities. One of the goals of Intersections is to meet our partners where they are on this continuum and to help them move in an upstream direction. This is a concept we've constantly revisited throughout the initiative. We've learned that upstream systems change is hard to measure quantitatively, and we're exploring qualitative models that best reflect dynamic change, especially related to resident engagement, capacity building, and relationship building activities that we know must come before long-term policy and systems change is possible. Additionally, we've seen that the hospital partner can play a vital role as a coalition leader, a convener, or a thought partner. Whether the hospital partner leads or supports is based on each individual community's history and capacity, taking into account those dynamics to determine what is most appropriate. We've also seen firsthand the importance of being flexible. While all of our communities have been working towards long-term goals that address root causes of poor health, inequity, and trauma, they have also been impacted by external events, such as compounding wildfire seasons, the COVID-19 pandemic, and the growing racial justice movement. In light of this year's events in particular, the initiative will be extended into 2021 to provide additional sustainability planning support. And with that quick overview, I will now turn it over to Dan, our hospital partner lead in Sonoma County, to talk briefly about the work that's been happening there. Dan?
Thanks, Katie. Yeah, in Sonoma County, we began the Intersections Initiative immediately in the wake of the first of what has now become 3 consecutive years of wildfire disasters. And so that was kind of foremost on our mind as we brought our community partners together and started to grapple with how's this going to impact our housing market and the housing challenges of our community that were already a problem, and they were only exacerbated by the fires. So housing equity was the issue that we chose. We didn't think we were going to go about building more housing, but we wanted to affect the policies around housing equity that might impact those communities that we were concerned about. So whether it was just cause evictions or anti-income discrimination, issues like that were of a concern. And the fact that we just come through a traumatic experience, we were also concerned about how do we deal with that? How do we help our community of service providers adequately respond to their clientele who've experienced profound trauma? So we chose a strategy where we were looking at developing capacities within our community of agencies that were at the table. And these were not just service providers, there were funders, there were government agencies, there were legal aid organizations all at the table. So we wanted to see what we could do with that community of people and enabling them to be policy advocates. And so we started to focus on those housing policy issues where we could have an impact locally and statewide. But we also wanted to bring the voice of those residents into the conversation. And so one of our key strategies was to begin developing what we're calling the Sonoma County Tenants Union, organizing tenants throughout the community to give them voice, to have them give influence on the policies that we were working on, and also to develop leadership within that community for ongoing kinds of health improvements that we know comes with that feeling of capacity, that feeling of agency that those communities would have over their lives. And then we also developed a trauma-informed practice training to bring to service providers so that they could be better equipped to deal with the trauma of their clientele were experiencing. And so, you know, since then we've had 2 more wildfires, we've had our pandemic. It's been, feels like one thing on top of another, but I feel like the work that we did was so effective at preparing that group of people to respond to those events as they happened. We're looking forward to kind of the sustainability around, primarily around that tenant engagement, that resident engagement. So we're going to be continuing that tenant organizing into the future. And then the policy and advocacy work will continue as well now that we have an infrastructure in place for enabling providers to actually weigh in and participate in advocacy around these policies. So still a lot of work to do, but I think we're feeling very good about the future of not just the coalition, but the impact it has in our community.
Thank you so much for sharing that, Dan. It's been a pleasure working with you the last couple of years and excited for this opportunity to highlight your work. For people who want to find out more about the Intersections Initiative, I invite you to visit our website, intersectionsinitiative.org, and our contact information is also available here as well. Thank you.